Hi, I'm Dr. David Danish, a double board certified psychiatrist specializing in ADHD across the lifespan. I work with kids, teens, adults navigating the sometimes frustrating process of finding the right stimulant, the one that works well without changing your personality or making you feel like you want to jump out of your skin. And today, I want to talk about a medication that does not always get the spotlight, but really does deserve it: Dexedrine Spansules. Dexedrine Spansules are an extended release version of dextroamphetamine. They're not as widely known as the famous ones like Adderall extended release or Vyvanse, but for the right patient, they can be quietly transformative. Parents often ask about Dexedrine when their child struggles with side effects from mixed amphetamine salts like Adderall. Adults sometimes find their way to Dexedrine after cycling through many medications that helped a little bit but caused those side effects I mentioned before. So, let me walk you through what Dexedrine Spansules actually do, what they're good at, and what to watch for, as well as my honest take after years of prescribing all stimulants to many ages of patients with ADHD. Dexedrine Spansules contain only dextroamphetamine, the more brain-focused half of the amphetamine molecule. That's different from Adderall, which includes both dextro and levoamphetamine. Levoamphetamine tends to affect the body more in negative ways, so some people feel extra jittery or notice their heart rate spike on Adderall. That doesn't always occur with Dexedrine. In terms of mechanism, dextroamphetamine increases dopamine and norepinephrine, especially in the prefrontal cortex, the part of the brain that handles focus, attention, impulse control, emotional regulation. The Dexedrine Spansules technology releases in 2 phases, some right away and the rest gradually over about 8 to 10 hours. In real life, that means more stable coverage throughout the school or workday, fewer roller coaster moments, and a smoother landing at the end of the day. Side effect wise, and I'll be sure to put a full list of all side effects for Dexedrine that you can access for free in my Mind Vault at drdaviddanish.com. In most of my patients starting this, the usual suspects would be decreased appetite, especially at lunchtime, insomnia in cases where it's lasting too long, mild dry mouth, mild stomach upset. These tend to go away with time. They are rare and they can be dose dependent. Mild increases in blood pressure or heart rate sometimes occur. Of course, if that happens too long or too high, it's a bad fit. In extremely rare cases, in fact, I've never seen it myself, there's a theoretical risk of psychotic symptoms in someone whom should not be on stimulants to begin with. And in those who have untreated or undiagnosed bipolar disorder, stimulants can induce manic symptoms. So that needs to be watched for and known about. In some patients who have what's called Raynaud's, or a tendency towards cold fingers and toes that might turn blue in the cold, I've had some patients have that get triggered by stimulants. Now, let's talk about heart health and EKGs. Do you need an EKG before starting a stimulant? Here's my approach. I do recommend a baseline EKG if there's a personal or family history of heart problems such as arrhythmias, unexplained faintings, chest pain, palpitations, things like that, congenital heart conditions. In healthy individuals with none of those red flags, there is no evidence to show that an EKG is needed. Now, still check blood pressure and pulse at baseline and when they're on the medication. EKGs that should be done after the treatment starts include those who have chest pain and irregular heartbeat, feeling like your heart's skipping a beat, or palpitations, some people call it. If that's occurring, get an EKG to make sure that this is not causing a problem. I'll make sure to upload a whole screening checklist that you can access for free. Here's where I land on Dexedrine Spansules. I reach for this medication when someone has tried Adderall extended release or Vyvanse, and it worked well, but with side effects they didn't like. Maybe they felt overstimulated. Maybe it caused insomnia. Maybe the anxiety and irritability from the fluctuation of the Adderall was too much. Dexedrine tends to be a cleaner option in those cases because it's just dextroamphetamine, less body noise, more mental clarity. Now, it's not the easiest medication to titrate since you can't split the capsule. You cannot. But once we find the right dose, the predictability of its release is a major win. I think of it like a vintage tool, nothing flashy, but incredibly effective when used in the right setting. If this was at all helpful, please subscribe and share it with someone else who might find benefit in it. And please, again, visit the Mind Vault for a full list of all the pros and cons of this medication, as well as all of the stimulants and non-stimulants I use to treat ADHD. I'll also be sure to link you to the best executive function coach team in the country. You should know about executive function coaching if you or a family member has ADHD. Executive function coaching is 50% of the treatment of ADHD, the other 50% being related to medication. Thanks for watching. Stay curious, stay informed, and I'll see you in the next video.